about a press conference.
Oh, you really?
We can just order the morale.
That was Sammy Scott this morning. He says, at his regular job, he says, they give me a bad time because they think I'm a Yankees fan. And he says, you'll notice all the photos are black and white and pre-Steinbrenner.
Yep. There's lots of us.
Are you ready?
Hi, I'm Bill Kennedy, Marketing Director at Jamestown Hospital. I'd like to welcome you all here for an announcement very important to the hospital. And the first person I'd like to introduce is Harvey Hubert, Chairman of the Board for the hospital. Harvey?
Thank you, Bill. Good afternoon to everyone. It is with deep appreciation and pride that we are here today to announce that the United States Department of Agriculture has announced today approval of a loan to the Jamestown Regional Medical Center. The loan amount is $46 million, spread between a direct loan and a guaranteed loan, which will be very beneficial to us. This is a culmination of 4 years of planning and design and budgeting in getting this project to become a reality. We've been awaiting word for a period of 60 days, and it gives us feelings of relief again, but also of deep appreciation to the U.S. Department of Agriculture for its support of this very important project. And with that, we have senior staff available to answer questions, and if there's questions of the board, I would respond to those. Thank you.
My question is regarding the fact that it's $31 million in direct loan. Do you have any kind of a guess as to what the difference now will be as far as interest rate and how much money is saved?
Maybe I defer that to Alan to comment as far as the cost savings to the hospital.
Introduce yourself.
Hi, I'm Alan O'Neill, Vice President of Finance for Jamestown Hospital. Can you repeat the question again?
Originally they had talked about $23 million, and one of the comments that Marty had made at one point was that if we could get more of a direct loan, then we would save, as a hospital, we could save a great deal of money because the interest rate is lower than a guaranteed loan. And I was just wondering if you got a guess.
Sure.
As to the difference.
Yeah, there's two points to that. One is the reduced interest rate, which is over 2%, and the other is the extended term. And the calculations we've done show that the difference is going to be about $175,000 a year in savings from 23 to 31 million, and that's over a 40-year period, so that's pretty significant.
Alan, I want to ask you a question. What is the percentage that the guarantee, that the direct loan is? What is that percentage?
The direct loan is in the low 4s. We'll still need to finalize that as we get through the final conditions with USDA. Okay. And on the guaranteed, it will be in the low 6s. So consider the interest savings over the principal. It's pretty significant. Plus the benefit I mentioned of the direct is that it is for a longer term, so you can extend it out an extra 10 years, which helps as well.
So the guaranteed is only 30?
Yes, the guaranteed is for 30.
I would add one additional comment just for the benefit of the public or to the readers that may hear or read of this announcement, is that the congressional delegation for North Dakota has been very supportive of this project. And I think they look at Jamestown Regional Medical Center as a critical access hospital, as an organization that will provide services throughout the 100-mile radius of Jamestown. We have 61,000 people in our primary and secondary service areas, and this will really enable us to better serve those people, to continue to provide quality care at affordable rates. Thank you.
The next question is, will you start construction this fall? I think so.
I'm not sure if I'm privy to all of it, but I think clearly the awarding of contracts that have been done indicates that we will break ground this fall. I think we may be hampered somewhat with weather. If the weather conditions are cooperative, we will definitely get this project in the ground this fall yet.
Just add this one thing, that the construction crew is in the process today. Hopefully they're out there right now that the weather has slowed, the rain has gone away, and they're starting to lay the road. And that's a pretty significant piece. It takes them about another week or so before the road will be completed. And now that the USDA funding has been committed, then the construction, as Harvey mentioned, the steel and concrete portion of this process can get kicked off.
I'd like to ask a question of the two vice presidents.
Yeah. Cindy and Ricky, could you come over, please?
I'm glad to be doing
This is
that.
Cindy Goner, the clinical vice president, and Ricky Ramlow, vice president of human resources and ancillary services, both of whom have been amazingly directly contacted with this whole process from the very beginning. And you couldn't have had two better people to answer the questions. I know, but she will.
I was wondering how it affects you. What do you do now? Both of you.
I guess actually, for us, we have been very busy this last 2 weeks reviewing plans. So we have just done an entire departmental, room-by-room review of all of the plans. And actually, we are going to have go and meet with architects on Monday for a construction meeting where we're going to discuss any things that we had seen in this review, that this is a perfect opportunity to make some final changes, assure that we understand the plans and that everything is as we picture it in our minds. So we've been very busy doing this plan review. So
I guess maybe I just might add that the staff are very excited about going out to a new facility, and they've partaked in helping us with the design and as best that we can picking products out for the new facility, and we'll be taking some of our equipment with us, and we'll be obtaining some new equipment in some of our departments. So I think the staff would express that they're very enthusiastic about the start of the new project.
Harvey, do you have a comment before we close?
Only to say thank you to the media present today here for showing up on a short notice as the announcement was made apparently in one of the statewide newspapers earlier today. So thank you for being here late this afternoon. And with that, I think the conference is closed.
I'm so glad I could hear you guys.
Well, I was waiting.